Thanks for joining us for another Facebook Live. This week is World Breastfeeding Week. World Breastfeeding Week occurs every year during the first week of August. It was first celebrated in 1992 by the World Alliance for Breastfeeding Action and is now observed in over 120 countries by UNICEF, the World Health Organization, and their partners, including individuals, organizations, and governments. Though there are multiple ways to feed infants, breastfeeding is the option with the most proven benefits for both parents and infants. Today we're sitting down with certified pediatric nurse practitioner and lactation consultant Laura Haskin to learn more about breastfeeding. Laura is a nurse practitioner and lactation consultant for newborn infants and parents here at Children's Hospital of Richmond at VCU. Laura, do you want to start off by telling us a little bit more about your background as a nurse practitioner and lactation consultant?
Sure. I became a nurse practitioner back in 2004 and have spent my career mainly working with newborns. I started out as a NICU nurse and then transitioned to becoming a nurse practitioner in the newborn nursery here at VCU. And I have really enjoyed just getting to know new moms and new babies and helping them through their journey. I became a lactation consultant after I had my first baby, and even though I had spent several years working with babies and helping moms and babies breastfeed, when it came time to do it myself, I realized that I had no clue what I was doing, and I needed to get more information, not only to help myself, but really to help my patients. And so it was really a personal thing that kind of spurred me to do that. And I've now been a lactation consultant for 10 years.
That was awesome. So let's just dive into some questions. What are some of the lesser known benefits about breastfeeding for both parents and infants?
I think we all hear about the benefits of breastfeeding for babies, like decreased rate of illness and certain cancers and allergies and asthma, eczema, all of that. But what's not really known as much about or thought about are the benefits for moms. Decreased cardiovascular risk and later heart attacks, decreased risk of osteoporosis, and then decreased risk of several cancers for mom, specifically breast cancer. So there's many benefits to both the baby as well as the mom for her actually lactating and doing that.
Oh, awesome. And as you mentioned before, like you became a lactation consultant after you had your first child. So what are some of the common troubles that people encounter with breastfeeding, and are there medical interventions that can help, or how can someone seek that out?
Yeah, there are. I would say probably the most common concern that we see is doing with the latch, or the baby just not being able to feed well, or pain. And so pain, if you're having pain with breastfeeding, that most likely means that the baby's not latched on correctly. Another concern that happens quite a bit is just with the milk supply, either having not enough or having too much, or even just the fear that you don't have enough. That's one of the problems with breastfeeding, is that you can't see it, so it's kind of a leap of faith, and that's hard for all of us. So those are probably the most common ones there. As far as medical interventions, there are some ways to help moms with their milk supply. A lot of it is actually more kind of practical help and really just hands-on, trying to help that baby latch at the breast, and then just trying to make sure it's going well. So careful observation and then hands-on help.
Cool. So that covers a little bit more of the traditional ways of breastfeeding, but are there any non-traditional ways for parents to breastfeed?
Definitely. Families kind of come in all shapes and sizes, and you may be considering adopting a baby, and so you didn't actually give birth, but are interested in breastfeeding. You may be a transgender mom and be interested in breastfeeding. So there's a lot of different family dynamics. Sometimes we'll have single-sex couples where both of the moms are interested in breastfeeding, and so playing around a little bit. There are some medical protocols and ways. Most of them involve coordination with the woman's healthcare provider as well, but it's a lot of kind of pumping and some hormones and stuff to induce lactation. Lactation normally starts as a natural part of the process after giving birth, but if you didn't physically give birth, there are some ways to kind of trick the body into thinking that you did.
That's awesome, and that's awesome that those services are offered right here for
it's really rewarding
Yeah.
to really help each family achieve their goals, whatever they might be.
Yeah. What are some of the biggest stigmas that you see associated with breastfeeding in 2019?
For many cultures, the chest is a sexual object, and so it can be seen more as not something that should be kind of displayed or seen in that way, and that goes along with breastfeeding in public. Despite a whole lot more knowledge about breastfeeding and more events like this where you actually kind of talk about it, stuff like that, it still is sometimes kind of a little taboo to breastfeed in public here in the United States. And so almost every single week we hear about, some mom and baby experiencing something out in some public arena. So it does need to be known that it is okay to breastfeed in public. It is not against the law. But, families need to know kind of maybe how to do that, or how to do that more comfortably and safely in this environment.
Yeah, and I think the more we talk about it, the more it's becoming the norm.
Yeah,
and
yeah.
fighting those stigmas.
Yeah, it slowly is. We really just kind of rates of breastfeeding have gone up and down throughout time, and we are on an upswing. We're going up, which is great. But because 20 years ago, not many people were breastfeeding at all. It's just there's many people out there who don't know enough about it or kind of see it as an unknown.
Yeah. What are some tips that you have for parents who are breastfeeding in order to support their physical and mental health?
Certainly getting a lot of rest. Everyone says to sleep when the baby sleeps. That is really easier to say than to do. But certainly to try and have some downtime when the baby is sleeping, and whether that's doing something that they normally enjoy before they became a parent, I think is really good for their mental and their physical health. Just because becoming a parent, whether you breastfeed or not, is such a huge transition in your role, so that can be helpful. The other one is really to accept any and all offers of help. I often, will tell pretty much every family I see, don't ever refuse a meal again. If anyone wanted to bring me dinner tonight, I would accept it. And my baby is now 5, so I think that that's pretty key. And then anything that you can take a shortcut on, especially as you're just doing something above and beyond.
Yeah.
So.
Rolling off of that, what are some of your top pieces of information that you want people to know about breastfeeding?
It's hard to, because in this day and age there's information overload out there. But really just that breastfeeding doesn't necessarily look the same for everyone, and it doesn't have the same start and finish for everyone, so you kind of have to go on your own journey. It does take support, especially in the beginning. Very few babies are born right off the bat knowing exactly how to do it, and so it does take some help. And the other is that there are resources out there for moms to get help. You've got your pediatrician, you've got your OB provider, you've got the WIC office, you've got maybe a neighbor down the street. You've got clinics such as ours. There's help out there. There's the Lactation League, there's support groups, there's your doula, there's varieties of things, and don't be afraid to reach out for that help.
Awesome. Well, you answered my next question. But I loved hearing about your path that you took to becoming a lactation consultant. What is your favorite part about that role?
Overall, I just love just seeing these moms and families kind of just go along their journey. Sometimes I'm not quite sure how much it's the intervention that has helped them, or if it's just standing by their side.
Yeah.
So I really consider it to be a privilege to be involved with them, especially in the first few months of becoming a parent. And it's such an anxious time. It's such a wonderful time, but it's just such a highly emotional time, and just to be with them.
Yeah.
I really enjoy.
That's really special, and it's great to know that they have that one-on-one care here.
It's nice. It's really, really nice.
Yeah. Cool. We just got a question written in. What are some typical breastfeeding supplies?
That's a good question. If anyone's gone out onto the baby aisle at Target or Walmart or anything like that, there's tons of stuff out there. It's not a bad idea when thinking about getting ready to breastfeed to go ahead and get a breast pump. Okay, it's a nice thing to have on hand. And if you have any difficulties with latch, you can then always kind of go to their pump. There's various pumps on the market out there that are really good, and you are able to get a pump most often through your health insurance.
Awesome.
Okay, and that's something that you can even do ahead of time while you're pregnant. Call up to your health insurance and get one sent to you. Here in clinic, we use the Medela pump. This is a hospital grade pump that we enjoy using. The other thing that we actually have is a support pillow. We always say that kind of when you're first breastfeeding, that it feels like you need like 4 hands, and you only have 2. And so that's where having a nice supportive pillow can be really helpful, just because the baby doesn't have a whole lot of head support when they're born, and they're kind of floppy and all over the place. And so that's really nice. The one I really like and recommend is the My Breast Friend pillow, because it has a nice flat, firm surface, and this is our hospital grade one, so that we can clean it in between patients. But it's nice and flat, can wrap around the mom's body, and it doesn't slip and slide, all that kind of stuff. If you don't have something like this, honestly, like a couch cushion can work really well. Those throw pillows tend to be kind of like nice and thick and hard, or even just a nice hard pillow that like you don't enjoy sleeping on all that often can be a great support pillow for the baby.
That's awesome.
It's not a bad idea to have a few bottles either, because again, in the beginning, sometimes they do require to have a little bit of some milk in a bottle. So those are all good things just to kind of have at home.
Awesome. So to wrap it up, how can parents learn more about lactation consulting services offered here?
So we do offer appointments here to our families, whether they seek us for their pediatric care or not. And we do offer this through their health insurance. So that's really nice that we're able to access a large amount of the public care. And it's, through their health insurance and not upfront paying. You can make an appointment by calling the call center here, or you can learn more about our services on our website.
Awesome. And we'll post that phone number and link in the comments below this video. Well, thank you for joining us today, Laura.
Oh, you're welcome.
And if you guys have any questions, please leave them in the comments below, and we'll reply as soon as we can.